Welcome back. Thanks for liking us and following us on Facebook. I'm Jake, owner of Clinical Exercise here in the Spokane Valley and a corrective exercise specialist. Today we're going to talk about the 5 ACL stretches and exercises for pre and post-op. So we're kind of looking at the basic rehabilitation of a knee. So Stephanie's here with us to help today. Number 1 is going to be the heel slide. So I'm going to have Stephanie start to do the heel slide, and she's just going to take her shoes off and gently slide her leg in and out to whatever comfortable range of motion she can. She's going to stabilize on the left leg and just gently slide the injured or the leg that had surgery in and out, just trying to keep that fascial tissue from getting stiff, creating some nice range of motion through that area. She's getting a good stretch on the hamstring, and she's getting some activation through the anterior hip. The next one here is going to be the squeeze and straighten, so I'm going to help Stephanie up. And this one here is going to be a little more focused. She's going to put her hands on her knee and she's going to stabilize her patella. That's just to keep pressure and stress off the ACL. And she's going to focus on straightening down to the floor, flexing down and pushing that down. We're trying to gain back all of the range of motion, or as much of it as we possibly can, from the surgical intervention here. So this is especially relevant after the surgery. All of these we're going to be doing at 12 to 15 repetitions, very slow and controlled. For demonstration purposes, we're going to move a little quicker, but she's stabilizing the patella, straightening the leg down. The next one's going to be the ankle pop, so I'm going to let you sit back down there or lay back down. We're going to slide this underneath the ankles. Good, let's put both feet out on that. You could do one at a time or both. I'm going to have Stephanie bend this leg and put it on the floor. The important part here is that when you got your leg up on the foam rollers, make sure the heel is not touching. You want the ankle to be nice and free. And Stephanie, I'm just going to have you do some nice circles for me. And we're just going to work that ankle joint through the full range of motion. And all these interconnecting muscles, of course, are coming up in and around near the ACL, all the way up the thigh and leg. So we're just trying to, again, prevent scar tissue from forming, prevent adhesion development, and try to get as much mobility and circulation through the tissue as possible. Next, we're going to move this foam roll up a little higher, put both legs over the top for me. And this time, we're going to work on a little bit of knee extension. Very controlled, very small. We're just going to lower the heels to the floor and then just very gently flex the legs up. So a very small controlled movement, moving that ACL in there and then making those inner knee muscles, the VMO muscles, activate and begin to strengthen. Breathing smooth, breathing regular. And the last one here, we're going to slide this out and we're going to keep the left leg bent. Good. And this leg here, we're just going to work on whatever range of motion she can initially here with a straight leg raise. So Stephanie, we're just going to lift that up nice and slow. Start strengthening that hip flexor again, getting some dynamic mobility through that hamstring. And back down. Good. Let's do one more of those. Good. And for review, we're going to go back through these again really quick just so you get an idea. So number 1 is the heel slide, Stephanie. Let's demonstrate that one more time. You can go a little faster now. We're just going to move that foot in and out, sliding the heel along the floor, activating those muscles. Good. The next one, I'm going to sit you on up. We're going to come up one more time. She's going to stabilize that patella. She's going to straighten that leg down, put a little gentle pressure on it. Start trying to get back that full range of motion again. Very good. We're going to slide this back underneath the ankles. Let's just do the one leg for now. Good. And she's going to work that circle range of motion. Make sure that heel is not touching the support structure and let her get that full range both directions. Good. Then we're going to slide this back in here. Good. Perfect. And we're going to work on that nice, easy extension here. Up and down. Nice little flex through the thigh muscle. Work the quad. Good. And then lastly, we're going back to the single leg, straight leg lift. Nice and smooth and controlled through a full range of motion. And there you have it. So thank you so much for checking in. Keep following us. Please share this video with anyone you know that could benefit from ACL stretching and exercising pre and post-op. Have a great week.